Hi, my name is Kay Skadumi, and I'm an assistant professor at Duke School of Nursing at Duke University. The talk today is called Neurovascular Connectivity and Prediction of Outcome in Acute Ischemic Stroke. The study of the mechanistic behavior of the ischemic brain is of paramount importance to neurocritical care, as it sheds light on mechanism underlying ischemic insults and helps in therapeutic guidance. The impact of ischemic attacks on neurophysiological dynamics regulating neural activity and cerebral blood flow, known as neurovascular coupling or NVC, remains quite poorly understood. We here in this study investigate the alteration of NVC in patients with acute ischemic stroke who underwent endovascular recanalization. Um, we analyze synchronized recordings of surface electroencephalogram or EEG bilaterally and transcranial Doppler acquired within 24 hours of mechanical thrombectomy in 14 patients with acute ischemic stroke. We calculated directed transfer function, or DTF, and partial directed coherence PDC between EEG and cerebral blood flow velocity, or CBFV, channels by using time-varying multivariate autoregressive model. And so these are metrics for connectivity estimation. Time frequency profiles of DTF and PDC were then in both connectivity directions, in EEG towards cerebral blood flow velocity and the opposite directions, were then compared and analyzed for predictability of neurological outcome and discharge, assessed by a binarized modified rating scale, or MRS. A subspace k-nearest neighbor, KNN, algorithm and a logistic regression model were then trained to predict a binary outcome discharge using different resolution of the temporal profiles of TDF and PDC. In terms of results, we found strong connectivity observable bilaterally in a subset of connections in the EEG towards flow velocity direction, indicating a possible neuronal drive of cerebral blood flow dynamics in some but not all connections. EEG channels showing maximum connectivity were mostly contralateral to occlusion side, and areas of maximum connectivity between EEG channels and bilateral cerebral blood flow velocity channels were generally concordant. Clinical outcome at discharge was predictable about chance, with an AUC of about 81% using both models. In conclusion, measures of neurovascular coupling derived from bedside recordings of EEG and cerebral blood flow velocity may be predictors of short-term clinical outcome in patients with acute ischemic stroke. Maximum connectivity in brain areas contralateral to occlusion side may reflect a compensatory neurovascular mechanism in the healthy brain. Thank you.